The Sustainable Development Goals or Global Goals or SDGs are a collection of 17 interlinked global goals that are designed to be a blueprint to achieve a better and more sustainable future for all. Thailand is one of the 192 nations that have agreed to meet the Sustainable Development Goals or the SDGs at the United Nations since 2015, with the goal of doing so by 2030. We'd like to welcome back to the floor Kun Abhisit Vejjajiva for a discussion on the overall well-being of our public health policy, including the integration of SDGs. So please welcome Tan Abhisit back to the floor again.
Just recall the last session when I talked about the second lesson and the need to take a holistic approach. This is very much in the spirit of why the Sustainable Development Goals came to be. And I think it's important always to go back a little to see how all of this has evolved, to be able to understand exactly what we need to do as we move forward to try to attain the goals by 2030. I have to say that the Sustainable Development Goals succeeded what were called Millennium Development Goals. So those of you who are not as old as me may not know that was the case. And the Millennium Development Goals emerged motivated by the idea that economic growth wasn't the answer to everything. I think the way the Millennium Development Goals and subsequently the Sustainable Development Goals were developed was in recognition that while most countries, if not all, were competing economically using mostly GDP or GDP per head and growth as the only indicator, you found out that while many countries have achieved high growth, high income, they were not able to overcome a number of problems. And even until today, when there are surveys on happiness, it is also the case that happiness doesn't directly relate to the level of income or average income in that country. And so I think for a long time, economists and also other professions were questioning the need to somehow strengthen the goals or indicators where we might be able to measure our qualities of life. So for instance, in many high growth countries, they were using resources in irresponsible ways and therefore created environmental problems. And that became more and more important as it emerged that the damages they were doing was not only just to their own environment, but the whole world, the whole planet. And therefore, somehow we need to find growth that is environmentally friendly. We see a number of countries that embark on high growth paths, in the end hit some kind of cycle or became a bubble that burst. So we had financial crisis turning into economic and social crisis, and somehow the growth was not able to be sustained. We have countries where growth is not balanced. So sometimes they hit speed bumps because of inflation, because of current account deficit, because of the pressure on their currency, and so on. And almost most significantly, we also see that the average rate of growth says nothing about the lives of ordinary people. One of the most, I think, telling and for me important indicator is like a country like the US, where 20-30 years average income mean income has been growing steadily, but the median income has barely moved, which means that for ordinary people, they're not better off, and that there is an increased degree of inequality. So whether you talk about the these concepts, alternative concepts to pursuing economic growth just on its own, to the development of Millennium Development Goals, and then subsequently the Sustainable Development Goals that we talk about, this is where the motivation comes from. That ultimately, surely we want to be aiming for good well-being of people, which therefore needs a more encompassing and a set of balanced indicators to tell us where we are in terms of achieving well-being as a whole. And as you'll be familiar with, we have these 17, and the key word you should stress is interconnected goals, and often now classified into 5 P's, so it's prosperity, people, peace, planet, and partnership. And they have been monitoring the progress that all the countries have made. And I don't know whether you know exactly where Thailand stands. As far as I can see, among over 100 and something countries, in terms of progress, we rank around 43rd, I think, or somewhere around there, with a country score of around 74. The highest scores would be in the 80s, and there are a number of countries that would be maybe in the 60s and in the 50s. So we don't do too badly in that sense. We seem to be making progress, and as a high middle income country, it is, I guess, we are where people expect us to be. But the interesting thing is, we need to look closer at the differences in terms of progress that we make on the various goals. And so my comments or my remarks will focus on taking a lesson from why we are doing well in some issues and not so well in others, so that we can design the appropriate approach for development to correct this. As expected, I think the most progress that we have made apparently is on the goal number 1 itself, which is on poverty. And I mean, this shouldn't surprise you. Whenever there is some kind of international ranking like competitiveness and so on, as a whole, we have not been doing badly macroeconomically. And we have been able to use growth to steadily reduce poverty, although there is a big caveat that I will come to in a second. On most goals, we appear to be making progress. Some, I think, may be on track. Others maybe need to be accelerated. But there are 3 things that I think, well, two main areas that I would like to draw your attention to. The first is that we are not seen to be doing well at all on the issue of climate change and the environment. And particularly the goal of life below water, goal number 14, where we do rather poorly. So I think that suggests that this is an area that needs to be addressed. But there's one goal where there has been a negative assessment, and it surprises people, and that is goal number 2, which is zero hunger. You would have thought that for a country like Thailand, a high middle income country with steady growth, I know we would like to see maybe a higher growth, and we say that we've managed to reduce poverty. But the issue of hunger is seen to be is seen to reemerge, and that is despite the fact that we have one of the lowest rates of undernourishment. We seem, according to the people who assess this, to not make enough investment in agriculture. And because we also are faring rather poorly on the environment, there is a risk that for a country and the people that always pride ourselves on being so abundant in food, that's not necessarily going to be the case. And some people will say that's no longer the case in Thailand unless we drastically invest, improve productivity, and be able to handle the effects of climate change on the agricultural sector, as well as the need for a balanced nutrition program for our people, our children. When I was in politics, I travel up and down the country. There's one thing that always hits me as a stark reminder of inequality, and that is when I visit faraway rural places at the schools. I see so many small, undernourished children. On the other hand, when I tour Bangkok schools, there were too many kids with the problems of obesity. And this is all, something that we need to heed as a warning about the inequality, about the unbalanced progress that we are making. And so just looking at these variations in how well we do in the various goals, you come to the following conclusion. That in the end, despite all the talks from the planning agency, from whatever philosophy of managing our country, the country and the government is still very much stuck in the old paradigm, where they think that growth generated by trade and investment would somehow trickle down to everybody and solve all the problems. It will buy us, infrastructure. It will buy us a good health system. It will buy us a good education system. And if there were any kind of side effects, if you like, or damages that come from this approach to growth, we'll correct it. So if there were damages to the forest, we will try to stop that and reforest. If there was air pollution, we will try to then control it. And I think this approach, if we see the way we do things like this, it fits in with the assessment as to why we're making progress in one goal and not doing so well in others. But the problem now is deeper than that, because number one, COVID has undone even some of the goals that we have been able to do well in the past. And even before COVID, actually, I think the limits of the approach was being exposed. I don't know if you know, but even before COVID, we began to see absolute poverty rising. That never happens unless there was a big crisis, like say the financial crisis of 1997 or the Lehman crisis back in 2006 and 7. But recent income surveys show that absolute poverty keeps rising either in provinces or even at the national level. So that suggests that we are somehow hitting a limit on the approach to achieving even growth itself. And then if you look at the other things that we haven't been doing so well, as I say, it gets exposed by COVID, the inequality, the effect then on the management of resources and the environment and so on. And what's worse is that we are now facing a number of challenges that are new. Well, not exactly new, but were not there when the SDGs were developed. The first is the technological disruption, which calls for a different kind of education system, a restructuring of the productive sector in the economy, and so on. The second is climate change itself. The third is that we are rapidly aging as a population. So we have both the problems of more shortages of labor and also the lack of a good welfare system to support the vulnerable and the elderly. So not just the aging population, but from technological disruption as well. And rising health costs, rapidly rising health costs. All of this means that suggests that we can no longer not take the holistic approach and hope that if we somehow can generate economic growth, aggregate economic growth, that we can then bring all the other goals along with progress. That's not the case. And you know, there are every now and then I can see that the people in power, people in charge are still stuck in this old paradigm, that they don't somehow try to see that it's all connected. So let me just give you a couple of examples. You know, in recent times, whenever there are economic difficulties, the standard response now is for government to transfer some money to people, right? But it took the government so long to redesign this system of transfer in a way that it would reach ordinary people. They managed to do it for the first time with the projectคนละครึ่ง. Because before that, none of this money would ever reach people in the informal sector. And all the money just goes back to the modern retail sector, the telecommunications companies, and so on. And this is now a big structural problem, because I keep saying now that it's very, very difficult these days to help the poor without helping the rich. Because as soon as the money reaches the pockets of the poor, given the way the structure of the economy is evolved, that money is soon going to be sucked back to the big companies. And so they need to redesign this. But it took the government so long, you know, before they tweak the system so that this money would actually reach ordinary people, SMEs, and those people in the informal sector. Another example, you can have the Thai leader attend the COP summit, come back and say, look, we've been to the COP summit, we have announced we will reduce our carbon emissions. And then the next week, they approve coal-powered plants to generate electricity. So they're not treating these goals as interconnected. They think, oh, we'll do growth and then we'll fix the problems, almost as an afterthought. This approach will no longer do. And so the challenges now for me, I think, is in order to achieve the SDGs, is to, first of all, practice what I would summarize as 3 R's. The first R is we need a process of recovery. Because the last few years, I mean, I could argue that even before COVID, but especially with COVID, much of the progress that we've made in many, many areas have been undone. And there is an urgent need for us to recover. And I was disappointed by the priorities and distribution of all the money that this government has borrowed to spend during the pandemic. It should have been much better spent by strengthening the health sector as a priority, and also to try to fix some of the imbalances in the system rather than trying to find quick fixes and just think of money as to stimulate the economy by just throwing it around. So the first thing is recover. The second R is we now need to rethink and redesign our growth paradigm. And that is to say that, when we undertake whatever policy, especially economic policies, economic measures, we don't just look narrowly or focus narrowly on some kind of indicators. For instance, when the government says it wants to attract more foreign investment, that they would give more tax breaks, that they would allow maybe land holding or purchase of real estate, exemption from this and that, even city planning, town planning, even some environmental standards. That is no way in spirit of sustainable development, and we have to change that. The government, for every incentive, every measure, project, policy decision, needs to take into account the impact on the whole picture, including the environment, including health, and I would argue also including the distribution effects. Right? So again, going back to the idea that I've seen measures to try to attract foreign investment. Some of the investment that comes in, number one, employs very few Thais. All right, so maybe capital intensive, maybe ask for exemptions so they can hire foreign labor. So it's not generating employment for Thais. Sometimes this is for export and probably uses up our quota of export. Profits are repatriated to the motherland of the foreign company. And it might generate pollution here in Thailand. Right? The question is, well, what does that investment achieve apart from a figure that says we were able to attract so and so million bahts or dollars of foreign investment? You need, I think, now to rethink, redesign the paradigm of policy decision that fully takes into account these interconnected sustainable development goals. And from the recovery process and from this redesign and rethink of the paradigm, the third R is then to restructure the public sector, restructure the economy so that it is conducive to inclusive and green growth. And one of the big challenges that we cannot shy away from is that we're now going to need a proper and strong and sustainable welfare system to look after all the vulnerable groups in society, and in order to meet the uncertainties of the future, which is expected to be more volatile for everybody, including you and me. Don't think that you're in a highly skilled profession that in the future artificial intelligence cannot replace you. So for the medical profession or the health sector, I keep saying that, well, doctors are probably more at risk than nurses, because a good system of artificial intelligence with big enough data will probably be able to diagnose patients as well as doctors. But robots replacing nurses, possible, but not as easy and maybe not as popular. So, all this means that we need a welfare system, and that creates an additional question that if we want to design a welfare system that is effective enough, strong enough to give people security, we clearly need to revamp our tax system, because we don't have enough income to have a strong welfare system that we want, that will then be able to deliver the goals concerning health, concerning education, concerning quality of life, and so on. And that has to be restructured. And I think, the well-to-do people have to pay their fair share. We need to address the increased concentration of economic power and monopolization in our country in order to stop the structure of our economy becoming more and more unequal. That generates conflicts further down the line as well. And we also need to decentralize our whole public sector and be able to have a more flexible, nimble public sector that can respond to changes and challenges, that can be more abrupt, as well as design a system where, as I mentioned before, we are able to engage the other stakeholders in the country as a whole, because they will be the ones that will be able to help deliver on the goals related to climate change, the environment, and so on, much, much better than if the government thinks that it can do this on its own. Okay, so I think my time is up again. These are the thoughts that I will share with you about the need to basically to create a new paradigm on policy making and on our growth strategy in order to be able to meet all the SDGs by 2030. Thank you.
Thank you, Tan Abhisit, for an incredibly penetrating and insightful talk on holistic well-being. And I was particularly interested in how the history of the goals came from, because as the history has taught us that financial growth does not necessarily deliver to the well-being of the population. And the point of these SDGs, as Tan Abhisit has mentioned, is that they're interconnected, and to be able to develop each goal simultaneously, I think it would require a lot of change. And Tan Abhisit suggested that the changes could be like the 3 R's, which are recovery, redesign, and restructure.
I agree with Pim, and I absolutely love the part that Tan Abhisit illustrated many of his points through an easy to understand examples that all of us can understand, such as how rural students have malnutrition problems while students in Bangkok are suffering from obesity. And that reflected a lot of inequity in society that are happening right now. And I absolutely love the part that, that right now I'm not sure as to whether I would have my job as a medical doctor in the future or not, as the AI are really taking that away from us. However, with these talks, I'm sure that our audiences are also having many questions about our way forward in the future. So consequently, we would like to continue with our Q&A session on the holistic well-being with the integration of SDGs with no other than Kun Thanakom Huntragun, the founder of Beyond Public Health, as our moderator in this session. So please welcome.
Thank you, Ms. Tinpavi and Mr. Beam. First of all, I would like to thank former Prime Minister Abhisit Vejjajiva for his time on this section. Since the COVID-19 pandemic, we have been focusing especially on the third SDG, good health and well-being, and set it on top of the priority list. However, the emergence of this pandemic reveals that Thailand have been driven by the interaction of multiple determinants such as ecology, socio-economic status, inequality, and politics, which requires the authorities to consider COVID to be a syndemic rather than a pandemic. It uncovers deeply rooted social inequalities and brought racial injustice to the forefront of the public health and political attention. In your speeches, it seems like you are a firm believer of holistic health and well-being, in which you do not think that there must be a choice between the economy and the people's health. How should Thailand proceed in order to incorporate SDGs into our policies, such as reducing inequality, quality education, and sustainable growth amidst the pandemic?
I think Thailand should learn from the way we've developed our public health system. You know, I mentioned before that in your profession, we have had very talented people, but also very publicly minded people who have designed and pushed through some policy innovations for a country like Thailand. You know, I talked about setting up Thai Health Fund from earmark taxes from cigarettes and alcohol to fund activities by non-governmental actors in promoting health. And then actually redefining health, that is not just physical health, it's mental health, it's spiritual health, it's community health, and so on. And pushing through universal health coverage for a middle-income country, and you know, for engaging health volunteers. What that's teaching us is that when you take a holistic approach and you're willing to take on and push through for innovative ways of doing things, you can address well-being beyond some strict technical problem or number. And so if we take the success of the past in this area, now apply it to the way we do, say, economic policy decision-making. So as I said, you know, when you do a project, they ask you to do an environmental impact assessment or health impact assessment. They maybe now should do an impact assessment on how that affects inequity, for instance. But not just an afterthought. Not to say, well, we'll go ahead anyway, but if there are problems, we'll fix it later. But design the policy from the start to be friendly to the environment, to be friendly to public health, to be friendly to education, to be friendly to achieving a more equitable state of affairs. That's the way to do it.
Wow, I see that was an ingenious suggestions. Maybe we should consider more about it. Moving on to our poll that the audience has done, the majority believes that good health and well-being should be Thailand's top priority still amid the pandemic. What would you think are the major concerns that are preventing us from reaching the SDGs during this pandemic era?
Well, to be fair, I think the pandemic affects all countries, and I think would put a dent in the progress of most countries as far as the development goals are concerned. And that's why I say that the first R was recovery. We need to make up for lost ground during the pandemic. But I think what we can see from the pandemic is that it has exposed all the weaknesses that we may not see normally. And in the last session, when I said that the impact of COVID has hit people very unevenly, with people in the informal sector and vulnerable groups suffering much, much more. I think it points the way forward that you need to build a system of protection and to create security for these groups.
I see. Speaking of inequalities, also from our poll, there's a sizable portion of the audience that believes that reducing inequality should instead be our top priority. The measure of income inequality, or the Gini index, is about 35, which is, we are slightly below Serbia. In fact, yes.
I'm not sure which one is that? Is that income Gini coefficient or?
income Gini coefficient.
Well, let me just say this. We have to be careful that while advocating for a more balanced and holistic approach to growth, that we also don't believe that growth is meaningless. I mean, growth remains one of the strongest tools to overcome problems like poverty and various measures of quality of life. It's easier to have a growing economy than to have one that does not grow. So again, be careful not to try to make it a choice between you have to have growth or you have to have equity and so on, right? And I think that was a trap in the days of the Cold War, right? When communism promises equality, but when it was so at the expense of growth, they could not sustain it, right? And it wasn't even equal in the end anyway. So you have to be careful about that. But having said that, yes, I think it's important to tackle inequality directly. I'm not sure about your figure of Gini coefficient, and I have to say that the Gini coefficient moves very slowly, and in itself, income inequality is probably not the worst part of the inequality we have. I think if you look at the wealth inequality, you will see much greater problems because the concentration of land holding, of bank accounts, balances, deposits, most of it is in the hand of very few people in Thailand. And you have to add to that the problem of the lack of mobility. That is to say that, you know, if you're born poor, the odds are against you of getting out of poverty. And so it transfers from generation to handed down from generation to generation, which then generates more inequality. So it needs to be addressed. And to address that, we need to obviously create opportunities. And that means that we have to make sure that wherever you are born, you have access to good health and education, right? And then you have, from there, I think you would have a better opportunity at a good income employment. But in the end, you have to recognize that if the system is unfair, so for instance, there is not enough competition, there is too much concentration or monopolization, or monopolistic powers in the economy, you still have a lot of inequality. And also given I guess the new, it's no longer new, but what used to be called the new economy, where technology rewards only a handful of people, but reward them abundantly. There's a big chance that this will also contribute to more inequality. And therefore, a better and a fairer tax system is also required. We can't get away from that. And if we're not willing to talk about it, I can't see how we can develop a good welfare system.
I see.
Let me just expand on this and just to give you an example. Thailand has been in the process of reducing corporate tax income from 30% down to 25, down to 20. In cases, we say 17%. We do that because we say, hey, if we tax corporates higher than Singapore, higher than Vietnam, there will be no investment here. But let me ask you this. If you look at the corporates paying corporate income tax, I think more than half is being paid by a few sectors, like banking, like telecom, like energy. Tell me, do you really believe that investment in the banking sector responds to the rate of income tax that banks pay. I don't think if there's been an increase in the banking system here in Thailand, it was because taxes were reduced from 30% to 25 to 20 or whatever. And I think what we're just doing by cutting taxes in these kinds of sectors is just giving bonuses to shareholders and to a certain extent their employees. But it doesn't generate investment. And I'm glad that the G7 has finally taken up on this issue by now saying that there should be minimum corporate income tax to stop people from racing to the bottom. Because in the end, if you reduce taxes, but Vietnam also reduced, Singapore also reduced, nobody becomes more competitive, but all governments just lose income.
I see. So taxes are also an important part of our policy. So speaking of education and healthcare, it gives the opportunity for the less fortunate to move up. But a study from Mahidol University noted that a high disparity between the quality of healthcare in different provinces, with a 40% concentration of medical personnel within Bangkok and metropolitan areas. What are some of the policies that the government could implement to redistribute it?
Right. I think it's important, in all fairness, to recognize that during the push towards free education for all, during the push towards universal health coverage, you have to expect that in terms of the quality, there will continue to be unevenness or unfairness or inequality, because that was being pushed or being achieved in a relatively short space of time in order to cover everybody. But yes, you are absolutely right. We are now at a stage where on the face of it, we have, universal this, free that, but the quality is to be desired, and there is a lot of inequality. And as I say, this is where it becomes important to set priorities and use this to guide your policy-making process. I'll give you an example on education, basic education. We have often heard that the lowest quality schools tended to be small schools, right? And then there was a suggestion that maybe you should just abandon these small schools, merge them with bigger ones, right? Is that correct? The answer is yes and no. Yes, in some cases it does make sense to merge schools, but no, because in many places it's not practical for parents, for communities to do that.
Exactly.
Okay, so the first thing is it makes no sense to just say, let's have a policy of merging schools. You have to do, first of all, you have to do complete school mapping and set out criteria as to when to keep small schools. And then once you recognize that there will continue to be small schools, the system and criteria for financing has to differ. So for instance, when I was Prime Minister, schools get their budget by calculating number of baht per head of students in the school. Now in small schools, that's not going to work because the fixed costs are high, because the ratio of teacher to children has to be higher. Otherwise, you cannot provide them with quality education. So I had to design a system where for small schools, apart from getting so and so baht per head, there has to be a formula for a top-up. Likewise, if we look at the local authorities, local governments, again, there should be a system of top-ups or compensations for those local authorities or governments that are in areas that are poor, that cannot generate income, that need to look after maybe a wide area of people, but with low density and so on. I mean, it's this kind of allocation policies that will help address the inequalities.
I see.
And we need now to look at, the use of technology to help bridge the gap as well. The promise of technology is there, but I think from COVID we also learn, right, that online learning is not going to provide quality education for all, and then we need to learn the lesson from that and fix that. The danger with technology, and I think this is often underestimated or maybe just played down, is that technology, I think, is going to favor concentration, because I think the most important assets in a technology-driven economy now are the big data and the network. So if you have big data and you have a network, you're at a huge advantage, and that tends to create natural monopolies, if you like. So even if you've got new people, young people like yourselves with creativity and innovation, but if you need to have access to network and big data, and there are only a few people who can make money from that, it's still going to be difficult to get a more equitable structure.
I see. These are complex, interconnected issues. One last question from our audience. According to the Department of Mental Health report, our poverty rate is over 7% last year, meaning about 5 million Thai citizens are living in poverty right now. At the same time, the suicide rates are also increasing.
Right.
Some of our audience are concerned that poverty may have driven some of our peers into ending their life. How would we make our citizens live happily and choose not to end their life in our country?
Just a couple of comments first. I think poverty clearly does create stress, suffering, and clearly can affect mental health. I think the last couple of years, the problem of isolation as a result of COVID or COVID measures has made that even more acute a problem. So I've just been to a funeral of somebody who took his own life, and I asked the people who knew him, because I'd known him, and they say that he became more and more depressed because of the isolation, because his children and grandchildren were preventing him from going anywhere because they were afraid that he would contract COVID and so on. So isolation plays a part as well. So we hope that isolation, which when we overcome this problem of the pandemic, isolation will be reduced. But yes, it means that we need to tackle poverty and inequality to prevent these kinds of damages. But also, I think there is still room to continue to raise the awareness of the importance of mental health. I think when people talk about health, most people still think of physical health, and there is also a kind of stigma attached to people with mental health problems, which mean that they are unwilling to consult or are too afraid to consult because they don't want to have a label put on them that they have mental health problems. I think there's a need for a public education campaign to make people recognize that everybody can have a mental health problem. It's nothing to be ashamed of. It's something that needs to be that needs to be assisted, and we should have a system that encourage people to come forward to seek that assistance, and for people to provide that assistance, and for society to be understanding of people having mental health problems.